Just Right to Know. We're here exploring our Texas Medical Freedom Initiative with physicians. We are at the Environmental Health Center here in Dallas, and so we're going to be interviewing various different practitioners and hearing their tales of harassment from the Texas Medical Board. So if you would please introduce yourself and your practice.
I'm Marc Spurlock, MD. I'm board certified in family practice.
And Dr. Spurlock, how long have you been in practice?
35 years.
And what kind of patients do you normally see?
I focus on chronic fatigue syndrome and fibromyalgia.
And have you been harassed from the Texas Medical Board?
Yes.
And when did the harassment begin?
2006.
So basically, what was their inquiry based upon?
That original inquiry was about an IV that I performed to my patients to alleviate fibromyalgia pain that I use lidocaine in.
And was this something unique to you that only people could get it from your practice?
No, I worked for a company back then that was called the Fibromyalgia and Fatigue Centers. We had 15 centers around the country. We used these routinely throughout this country to help people with pain. That was not narcotic.
So, but the Texas Medical Board wanted to restrict you from providing this needed service to a large population of people who might be suffering with chronic fatigue and fibromyalgia?
Yes.
And where did the complaints originate from?
The original complaint came from the patient, but not about the IV. That came about that she was concerned about some supplements, but the board determined that there was no problem with the supplements, but they did not like the IV.
Now, something we've heard about supplements is one doctor called in, and because they didn't have a consent form to give out supplements, like the ones you can buy over the counter, they filed a complaint against her, and it cost her $50,000 because she didn't have a consent form signed to give a patient supplements. So they didn't have a problem with the supplements.
No.
But it's so when they weren't able to come in with what they thought was going to be a problem, they just kept looking, and
Yes.
they came up with this IV
Yes.
that is currently being performed by 15 other facilities around the nation, but the Texas Medical Board has a problem with offering it to our patients here in Texas. Is that right?
That is correct.
Okay. Well, are there any other, was that your largest?
No. My largest case was they submitted me a letter that said they wanted to investigate 12 patient charts. There were A's, B's, and C's, which was totally frightening to think about what was coming next. And
You mean alphabetically?
alphabetically. And they didn't really say anything except that I had violated standard of care and negligence with these patients. When I submitted the charts, they responded back to me. I had to meet with them in an informal hearing, and they had 25 complaints against each patient that were trivial, but one of the biggest ones was that I was not practicing standard of care for chronic fatigue and fibromyalgia because the only accepted treatment was graded exercise therapy and psychotherapy.
So this, let me see if I get this right. The standard of care, which is established by the American Medical Association that rolls down to each state, Texas Medical Association is very involved in determining standard of care, is that right?
I think so.
I think so. The standard of care for treating pain, which your audience may know someone who has chronic fatigue or fibromyalgia, and we're talking about a very painful disease. And in many instances, they really don't have an origin of cause. They just have a collection of symptoms that they put together and put on a patient, and this is that disease. So because the standard of care that is predominantly established by the pharmaceutical companies' influence to medical schools, perhaps, to where the only accepted means of treatment of many of these unknown diseases of unknown origin are through pharmaceuticals, or in some instances when they can't really nail it down to a pharmaceutical, we'll just lump it into it's all in your head. Is that kind of sum it up?
That's how many people see it? Correct.
And so because you had the ability to provide therapies that were effective with the lidocaine IV that you mentioned earlier, you're prohibited from doing that in the state of Texas because of, how was that evaluated? What peer review were you under to get to that determination that you had to stop giving that IV?
They had a pulmonologist and a layperson on the board that day. They just determined they thought it was dangerous to use lidocaine in an IV and that I had to stop doing it.
So a person who'd never done that kind of medicine determined that you couldn't do it.
Correct,
Subjective only to their opinion.
correct.
The way it happens, it's a kangaroo court before you go there. The decision has been made before you go there, and the doctor and this layman, they've been told what to say. They're just robots repeating what the people from the higher up told them to say.
So it starts out with a complaint, you get notice, and in many times the causes are very vague. Basically, the
Exactly.
cause for the inquiry is not following standard of care,
Correct?
okay, or negligence. They might throw in another word, but no other detail.
No,
Do you have the right to know who filed that complaint with the medical board?
they do not allow us to know who files the complaint.
Now, a little clarity on that is that there is a measure of knowing who your accuser is, but it is only when that accuser happens to work for an insurance company. So the doctors, if they know they have the right to do an inquiry, did you know you had the right to inquire who the complaint was from?
Yes,
And what kind of response were you given of who the complaint was from?
we do not have to release that information to you.
But that's not actually true.
It's
Because-
actually a violation of your Sixth Amendment right to face your accuser. And many times, the Texas Medical Board is throwing out the Constitution, throwing out the Sixth Amendment, the right to face your accuser, throwing out the Fourth Amendment right to unjust search and seizure of patient records, of the doctor's records, and through the intimidation that comes through that, suppressing the First Amendment right, both to speak of what you know to be the truth, and in the best interest of your patients based upon the experience. Because you had many people that were benefited by that treatment option.
Yes, many people.
What were their reactions to this when they were no longer able to get that treatment?
They were horrified because it did help them with their pain. They did not need narcotic treatments, and now we had nothing to offer them.
Representative Zedler had given me a court ruling that came out of the 24th District Court in Victoria, Texas, which basically stated that the Texas Medical Board was acting beyond their administrative authority by serving in capacity of law enforcement with the intent to circumvent the Texas and U.S. Constitution
Exactly.
requirement for warrant. Is that true?
Yes,
So when you were given notice that you were supposed to provide these 12 patient records, so where did you think that how did they pull those 12 medical records?
I didn't know until they sent me the real complaint, and in it was a list of narcotics that I had prescribed to my patients over the past year, and those 12 patients were all in there. And so then I realized they originally were coming after me for narcotic abuse, but they didn't find that at all.
But they came up with 25 complaints under each.
Under each of the 12 patients.
And what was an example of one of the complaints they would cite?
That I did not practice standard of care for treating chronic fatigue and fibromyalgia.
Which is greater exercise and psychiatric evaluation.
That's what they listed.
So, Dr. Spurlock, what did it cost you? What impact did this inquiry from the Texas Medical Board about those 12 patients? They couldn't find anything about narcotics, so they go nitpicking and take it from there. What'd they find?
We refused their response at the first meeting, and at the mediation, they sort of backed down, and they required me to present to them 30 records that they handpicked every 3 months for 3 years. And it cost a total of $30,000 or $10,000 a year for them just to read my records. And then on top of that was my missed time for seeing my patients and my attorney fees. And at the end, they determined that I didn't practice bad medicine.
So after how many thousands of dollars of attorney fees and being
much
able to...
attorney
Probably at
fees?
least, well, the total was probably at least $50,000.
For attorney fees?
No.
20
no.
for attorney
20
fees?
for attorney fees.
And 30 to the Texas Medical Board.
And then missed time from seeing patients.
Uh-huh.
And they originally told me it would only cost me $12,000 to do this, but it ended up being $30,000.
And when you were found not to be practicing bad medicine, none of that was ever reimbursed to you.
Of course not.
So do you think that could be construed as a revenue stream for the Texas Medical Board?
I can't comment on that, but that is a possibility.
Well, thank you so much for sharing your story with us.